Okay, I think it's good to go.
All right.
Okay, hi everyone. Hi, I hope you all are joining right now. And hi, this is Sanskruti Golte. I am from India right now, and I am here with Marlena, who is from Thailand. I'm living with type 1 diabetes since last 14 years now. And Marlena, can you please introduce yourself right now to our audience?
Okay, so hello everyone. If you don't know me, my name is Marlena Wilson. I'm from Thailand. I'm currently 24 years old and I've been living with type 1 diabetes for about 16 years now. So I was diagnosed when I was 8.
Oh, okay. I think we are good to go. And okay, so Marlena, how has last 16 years been? If you have to tell us diabetics in like one sentence.
In one sentence, the last 16 years have been interesting. Definitely an interesting experience. You never know what you're going to get the next day. It's always something new. I think routine, there's some sort of routine with diabetes, but it never goes as planned. I think you
Yeah,
probably
yeah.
understand Sanskriti so
It
well.
never, yeah, yeah. It's such a good feeling to be able to relate to anyone who lives with type 1 diabetes and knows what it's like to just wake up one day and go to a really high or a really low, because literally anything can affect your blood sugar, like the weather, the weird sleeping position, the less amount of water you have drunk, or the exercise, or food is all we know. But then, literally, any random thing can affect your blood sugar, and it's such a nerve wracking situation.
I feel like that's something that's not talked about enough or not really understood from like an outside perspective. Like if you don't live with type 1, you probably just think, oh, diabetes is what you eat, right? Like just eat less sugar if you have high blood sugar or you should inject more. But like there's so much like nuance or like little in between details that you don't realize goes through with living with diabetes. Like if I have a bad day, if I'm upset about something, that's going to mess up my whole day. Or if I'm upset, right? I've been crying, maybe I'm stressed out and I'm not drinking enough water and I'm dehydrated. There goes my whole day. Phew. So
I think,
it's so easy.
yeah, yeah, it really is. And I was just the other day, I was watching some reel and I came across this person who was trying to show his life and what happens when he doesn't drink enough water and when he drinks enough water. And I realized, wow, I've never thought some like I would relate to someone over drinking water, because yes, everyone says you need to drink enough water or 8 glasses of water, or you need to be like good with your water intake. But no one realizes that it becomes 10x more harder for us who lives with type 1 diabetes, that it just ruins your next 2 days just trying to bring your sugar levels in range again with such a small little thing as water.
I like it, just the daily living thing that you need to do can affect so much.
Oh my god, yeah. So, Marlena, when were you diagnosed and how was your diagnosis?
Okay, so every time I do a conference and someone asks me this question, I love it. Well, the experience wasn't so good, but I feel like the story's super dramatic. So I was diagnosed when I was 8 years old. I had all of the symptoms that many of other type 1 diabetics or people living with type 1 have gone through. For example, I was losing so much weight. I was thirsty all the time. I was going to the bathroom like a million times a day. And I think my parents just thought that, oh, maybe it was like a phase where I was growing, like growing pains and stuff like that. So they didn't really think much of it. And I think the moment when my family were like, oh, something's kind of off was when we went to McDonald's. And I was, these 3 months, I was so hungry. I'm like this little skinny year old, 8-year-old. And my I was like, Dad, I want a Big Mac. I want a double Big Mac. Right. So he orders me the double Big Mac, thinking, oh, okay, she's just growing up. And I eat that Big Mac set and I go, Dad, I'm so hungry. Please get me a double Big Mac. And he was all, you are so greedy. No, you're not going to eat a double Big Mac. So that's when my family thought it was kind of strange. But we had plans to fly to Austria because my dad worked there during the high season, during the summertime. So we didn't think much of it. And the day that we were supposed to fly, I was throwing up everywhere. Like I could not keep anything down. But we had just gotten back from the beach like 3 days ago. So my parents thought maybe it's food poisoning because I'm quite sensitive to seafood. So they thought, oh, maybe it's just the food poisoning. I'm sure give her some electrolytes, she'll be okay. So it is a 12-hour flight to Austria from Thailand with a layover in Qatar at Bangkok airport in Suvarnabhumi. They were like, oh, she probably just has a cough. It's fine, like she just has a cough. So we kept going and I slept the first 6 hours, and which really sucked because I remember this is the year that touchscreen TVs on the airplanes had come out, and I had missed the whole 6 hours, and my sister was like, oh my gosh, we can play on the screen, and I was sleeping because my body was shutting down, right? And so we landed in Qatar for our layover, and also the clinic there said, "Oh, it's just like a sore throat as well," which was weird because I'm still throwing up and I haven't eaten anything in like over 24 hours. And so then on the last leg, like our last flight, the last 2 hours, I woke up and I was like, "Mom, Dad, I cannot feel my legs, like nothing." So my dad tried to ask for help from the air hostess, and then they said, would you like to do an emergency landing in Turkey? My dad thought about this really hard. And he looked at her and he said, no, we don't have insurance. Please keep going. So I pushed through the last 2 hours, um, miraculously. And we landed in Munich actually, and the ambulance picked me up. They checked my blood, and the EMT said, oh, it's diabetes. We gotta get her to the hospital right now. And in the ambulance, they didn't know that my dad actually speaks German. So when they were sitting there, they were like, yeah, I don't think this one's gonna make it. My dad's in the back going, oh no, oh no. But, I'm still here. So 16 years later, I can share this really dramatic, but also surprisingly good story because I'm still here. So it was a good ending if you look at it like that. So yeah, that is my diagnosis story. It's quite an interesting one to tell because it's super dramatic.
Oh my god, yeah. You talk about dramatic stories and then there's yours. Oh my god, okay. Wow. So, hi Prashant, Prashant is here. And for everyone else, again, Marlena is from Thailand. And I would like to ask you, how was your journey living with diabetes in Thailand? So, for context, I'm going to tell you what it is like in India. India, diabetes is not covered in insurance, and we have to buy our own medicines and go to the doctor on our expenses and do all the checkups and the blood test and everything that comes along with diabetes, if you want to say that. Yeah, so how was it like for you?
Okay, so I think let me give everyone a little rundown on how the healthcare system here works in Thailand because I forgot to say that I'm a nurse as well. So I got some more minute details from behind the scenes. So Thailand, we have the private and public health system. For the public, we have, I would say, a pretty decent system, which is called the Universal Healthcare Coverage or the 30 baht system. Baht is the Thai currency. So it basically covers all conditions and you need to be registered it. So every Thai person has the opportunity to register for this universal coverage. And type 1 diabetes is also included. Now, it's really good. However, when you look at a deeper level, this also depends on what hospital you go to and the type of support that the public hospital that you're affiliated in with is with. Yeah. So, because I was diagnosed in Germany and Austria, my endocrinologist who diagnosed me had a connection with a doctor in Thailand because we had no idea where to start because I was diagnosed in a foreign country. So they said go and talk to this doctor and then they'll give you recommendations. So when we came back, this doctor was affiliated in one of the biggest public hospitals in Thailand, and they are the first and the biggest Type 1 clinic. So I was lucky enough to get put into that system. So usually how it works is your ID card dictates which hospital you go to. So because I had the connection with the doctor and I was in that area, I got to get really good coverage and good care. So I didn't have to pay for my insulin. I eventually joined programs where they were giving out, where they were testing like the free blood strips, because when I was first diagnosed, only insulin was given by the coverage. But then they started doing like tests to say, hey, if type ones check their blood more than 4 times a day, it shows better results and better A1C levels. So then we started adding the blood strips for free. So certain hospitals will also give out free blood strips as well. So yeah, so like I said, it depends. If you're affiliated with a really good hospital, then you get really good care. If you're in more rural areas and you don't have a type 1 clinic, the care may vary. So that's usually how the public system here works. It all depends on which area you're in and who's your connection. Yeah, so that's how it works in Thailand. The private sector, as like most places, is all out of pocket as well. Yeah.
Okay, great. So if someone is okay, that is good to hear that at least your insulin is covered. So that's a good news for anyone who's being diagnosed in Thailand, I guess. I wanted to ask you about the insurance system again. If you get sick or if you have some kind of emergency, so has it happened with you that you got into some kind of emergency? Keeping that in mind that you're a nurse and you're well aware of what you need to do, and even your family, because you were diagnosed at 8, they must have a lot of experience because that age is very tender and anything can happen at any time, especially with diabetes. So how was your emergency situations like, or have you had any really brutal emergency situations where your sugars have been rising or going really low? And what was that like?
So I would like to say that the only, luckily, fingers crossed, it stays that way. The only big experience that I had was my DKA when I was first diagnosed 16 years ago. I haven't had any bad experience so far. So, like I said, I like to keep it that way. But we did have a couple of emergencies where I had really bad food poisoning, where I couldn't keep anything down. So even when I was having a low, even if I drank juice, that was coming up anyways, right? So it got to about 5 hours through the night where I was just constantly at 50, like super low, and I couldn't drink anything. So we had to go to the hospital for like a dextrose strip, like a sugar like infusion. So that really helped. And the Thai system, like I said, the 30 baht universal coverage will cover that if you go to the hospital that you're registered with. So I would say that's a good thing, because if you have an emergency, then any hospital who's affiliated with that will take you in and minimal payment. Or if it is serious, you have about 3 days or 72 hours to refer to the hospital that you're affiliated with. So, for example, if I were to have a medical emergency, because I live on Koh Samui, I live on an island, I don't live in Bangkok anymore. If hypothetically speaking, if I were to have a really bad incident here and the hospital here said, hey, it's not really in our budget and she's not registered here, then they have enough time to refer me to the hospital in Bangkok. But yeah, so that's what the hospitals would do here.
Oh, okay. That doesn't happen in India, but hi, Akansha. Akansha says yes, there's no benefit in India, but the only benefit is the unpredictability of sugars. But yeah, that's life. I think that has become so normal for me. If someone says that, okay, the sugar goes up or sugar goes down, like that's my daily routine now. Like I have to deal with so much of it. That has been life for us. Yeah, the Buddha is saying that fantastic work by Thai government and 30 clinics at the oral health meeting in Bangkok last year. Oh yeah, she was at the Bangkok meeting last year. That's so cool. Okay, so the next thing I wanted to know was how was your school life? Like when you were diagnosed at 8 years old, and how was the transition? I know it was long ago, and now you must feel like, okay, I don't even remember how was my life before getting diagnosed. But yeah, how was your school life transition? Because were there any differences, like you had to take your insulin in school, and did you carry your insulin, or someone came to give you the insulin, like from your parents? Or how was your routine, or how did you transition from school to university and now as a working adult? So yeah.
So I would like to say I feel as though like many people who were diagnosed at a young age, it doesn't really hit you that this condition can affect so much of your life until you get to about your teens. If you get diagnosed before you hit puberty, then the first couple of years it doesn't really matter because that's all of your parents. I don't want to say burden, but it's your parents' responsibility, right? As a child. So this doesn't really occur to you until you become a bit more independent. And then you realize that, oh, every little detail that I do can affect my life. And as a child, having that sort of concept really does, I would say, mess with your anxiety, mess with your overthinking, right? And it's not really talked about, or in my circles at least, because I'm not sure. I feel like India and Thailand are still kind of similar in terms of like culturally and stigma wise, because stigma is still a big thing here in Thailand as well. For me, growing up, I was very lucky to have a very supportive family. Like my family have been my rock in terms of my diabetes. They've always like heard me out, listened to me, and had like my, when I would say something that would have, hey, I don't like it when you do that, then they would always, listen and kind of adapt with me. So it felt like a team effort as a family. So as a child, having that strong support from my mom and dad and my sister, I think made me more confident with my diabetes. So at school, the usual, oh, are you addicted to drugs because you're injecting? Like, are oh, you're doing drugs right now? Then you just say like, well, at least I can do it and you can't. Like there's ways to talk to other people about it. I was lucky enough that my mother at the time was also a stay-at-home mom, so she was able to every lunchtime she would bike to my school, which was about like an 8-minute walk. She would bike to the school, do my injections, and do a lot of my lunch for me. So my friends would say like, oh, you're not eating with us, like you're so weird that you're not eating school food. And then I would say, well, at least my mom has time to cook me meals, like there's ways to kind of stand up for yourself in the sense. So because I never tried to see diabetes as a negative thing until I hit like 13, and then here comes the teenage angst, right? Oh, I'm not the same, no one gets me, no one understands me. And I think during that time I didn't have that much connection with the type 1 community because the type 1 community in Thailand is still, to me, I find rather non existent. Everything is through, like, it's just hospital groups. It's the groups that you get added into because from the clinic, right? But there's no outside community outside of the clinic. So my mum took me to a type 1 community fair that was run by one of the hospitals, which is a really nice thing for them to do. But we're talking like 10, 12 years ago. And I go to the bar, like the food area that they have, all of the foods and the snacks, and I go get a piece of cake. And then the staff stops me and goes, are you type 1? And I said, oh, yes, I am. She goes, give me the plate. This is for guests and relatives only. The type 1 section's over there. And she points the fruit bowls. And as like an 11-year-old being told that I couldn't eat the same foods as the relatives because I had type 1 diabetes and I had to eat fruit and salad, I turned to my mom and I said, we're never going to an event like this ever again. I can't believe they said this. So yeah, after my mom took that to heart. So she never took me to any other events until years later when I hit about 18. I had a good community, I had good friends. I would like to say I'm quite glad that I wasn't bullied as a child by having diabetes, but I've had stories from other type 1s who have had terrible experiences in school who are also Thai. I was lucky enough that I had a good support system. But when I hit about 18, I got involved with the young leaders in diabetes. And I think that's the first, no, when I was 20, it really opened my eyes to see, wow, community is such an important thing. And I never realized how important it is to connect with people who understand your day to day condition on like a whole other deeper level.
It is so true. Like, so we also have like at Blue Circle, we have citywide, like different cities have meetups on different days, and all of us come together and talk about our lives or whatever has been bugging them. We try to guide each other because all of us have been living with type 1 since so long, and you never know, someone else's experience can help you, and you can learn so much from each other right now, and it is such a good thing to have, to be able to talk to other person and who will relate to you. So yeah, I think communities are really really special. um Okay, yeah, Prashant. Yeah, so when you were 20 and you're getting out of, I don't know, university and try like starting to work, uh, how was your transition that time? Like going from a student to an adult and taking all the responsibilities from your food to your appointments to making sure you have enough insulin for the entire month, or I don't know how it goes in Thailand. So did you get your entire month insulin once, or you are able to go and buy if you need it?
So in Thailand, like with the healthcare system, we do every 3 months. So every 3 months you come in and you do your checkup and your A1C test and you get your insulin and you get your supplies for the next 3 months. So the system's really good and consistent in that part. So as a child, I think my mum and dad really let me be independent once I hit about, I would say 13, 14, because I was like, I don't need your help. I got this. Because I think you probably agree, Sanskruti, that people who grew up living with type 1 have more independence. Like I find you mature much older than other people your age. So I became really independent quite early. And I started doing all of my own appointments when I hit about 16, because at that time my mom went from a stay-at-home mom to like working full time. So that meant that she didn't have enough or as much time to like take time off to take me to the hospitals. Whereas as a student, it was easier to say, oh, I'm sick, or I have an appointment. So it was easier for me to just do that by myself and not bother her. So I started doing all of my appointments when I hit 16, and the Thai system's pretty good. It's really annoying to get set up, or like you're at the hospital all day, because if you're in the public domain there's a lot of people in the system. So usually when I would go for a checkup every 3 months, I would have to be at the hospital at 5 a.m. So I'm waking up at 4 a.m. I drive to the hospital. I'm there at 5 a.m. They open at 6, right? I try to get the first queue in. I go do my blood test, and I don't see the doctor till like 9, 10 a.m., depending on how many people are in that day. So like a full day at the hospital would be 5 a.m. till like 2 p.m. And that's my every 3 months I go and do that. But now that I'm working, I was talking like we were talking behind the scenes for our viewers. Now that I've started working, I'm still trying to figure out what's the best option for me, because we have different types of health sectors in Thailand. There's the public, there's the civil servant one, and then there's the private one, and then there's also for like public or government workers. That's like a whole other type of insurance that I'm not involved with because I'm not in the government sector. But for the civil servant one, um I would have to, if I choose to go down the civil servant route, then my hospital that I work with will have to pay for that. But then I lose the privilege of having the universal healthcare. So I would lose my spot in that system. So then it makes it a bit difficult, because if I decide to leave my job, then I'm going to have to find another job that covers the civil servant one because I've already lost my spot in a universal, the UC one. Um, so I'm still trying to figure out, would it be best for me to just keep my universal coverage because, I would, even though it takes much more time and it's much more annoying to go through the system, at least I still have that strong support and it gives me more work flexibility if I were to leave my job. But then at the same time, the other one is way more convenient. So I'm still trying to figure out what's the best move for me, but I'm sure that's a problem for next month. Oh, it's then. Oh, yeah, there
Okay,
you
yeah,
go.
that's the problem for the next month. I hope you figure it out and take care of your spot wherever you find it. So, okay, other than your work, what other things do you like to do? Like, have you traveled or do anything other than your daily activities, like going to the hospital? I'm guessing. Yeah. What else do you like to do?
So I do like traveling, although I find traveling takes such a big toll on my body with living with type 1, just adjusting to the time zones and the food. So I do like traveling, but I don't like having to adjust my whole like schedule and my whole body clock. I'm quite an artist. I really wanted to go down studying art when I graduated high school, but of course, healthcare called for me. So I really like to draw. I really like music. I'm a big like a film nerd. So I really like to watch movies when I have time. Like love following series and comic books and TV shows, anything like that. Yeah, I would say I'm more of the artsy side. I've never been much of an athlete. I do like trekking, like going on hikes and going to waterfalls. But overall, I would say I'm quite an indoorsy person.
That's great to hear. So if since you said trekking, if you're out and about there, um, was it difficult for you to actually go out and take care of your health, or did it come easy because you have been dealing with diabetes since a long time? And do you tell people around you that you have type 1 diabetes, and if something happens, these are the steps you need to follow? Or yeah, how does it go?
So with me, I think after living with type 1 for so long, you sort of like, trial and error constantly. Even after 16 years, it's still trial and error. Um, but I grew up with quite an outdoorsy family. So we would go on hikes a lot. So as a child, my dad would always have like stuff prepared for me. So from day one, diabetes is all about preparation, definitely being prepared for any type of scenario. It doesn't matter if it's unrealistic or outrageous. You have to be prepared. There's no way. I think one time, one if I could tell a story, we had a school field trip. When I was in 12th grade, so my last year of school, we had a school field trip where we would drive 3 hours into the mountains and then sleep in the mountains, and then we would have like a 6 hour hike to the waterfall. And this was all just given on like a piece of paper of like what you should bring. So my family took me out to the supermarket like the night before, and we just bought so much juice, so much gummy bears, like just like a ton of granola bars. My dad like stacked my so everyone had like one bag. I had three, and two of them were just filled with my snacks. And luckily, we overpacked because I found out later that the school wasn't providing any other juices aside from the three meals that day. And we were in the middle of nowhere for like 4 days, right? So we weren't stopping at any supermarkets, and we were in the mountains. So it wasn't like I could go around the corner and get some juice, right? So the overpacking actually, I would say, saved my life. It's quite annoying. That's why I like to say I'm more of an indoors person, because just the whole mental process of doing an outdoorsy activity, it it, it takes time. I have to know what I need. So like when I go on a waterfall, because we did like a 6 hour hike, and my bag was so heavy with all my juices. But the funny thing is, all of my friends, they didn't prepare anything. Some people didn't even bring water for this 6 hour hike, by the way. And at the end of it, people were like, "Oh, I feel so like shaky. I feel so dizzy." So I started handing out my juice boxes to people because I figured, oh, they were probably having hypos, even though not even type one, right? And it worked. Everyone was like, "Whoa, I feel so much better." And I was like, "Yeah, that's why you pack juice. Diabetes knowledge."
That is so true. That has been so relatable. I know, like, my bag is 2x more heavier and bigger than everyone else wherever I go out. Even if I'm going to the supermarket or I'm going to anywhere like very close, also, I always tend to carry everything. Like, you never know what will happen. What will happen? Like, so at times I carry extra juice boxes or my insulin cartridge or needles or syringes. I will have everything you need. So yeah, us diabetics need to be prepared for anything and everything. You never know what will happen, and that is so cool that you were able to help others and that you were prepared and they were not. But that is so cool to hear that. So in these situations, were your friends like really helpful if something happened? You said that nothing happened to you, or you never went to a low or a high sugar level. But was it easy for you to tell them? For from this question, I'm trying to understand the diabetes stigma around in the society. Was it easy for you to tell others, not your friends or maybe your family or others outside your social circle? How has been diabetes interpreted by others? If you tell them that, okay, I'm living with type 1 diabetes, do you get a lot of pity, or are they encouraging, or how is it like in Thailand when you tell people? Because in India, whenever I tell anyone, I always get a pity face. Oh, sorry. That is what I always get.
I would say it definitely depends on what age range you're talking to. When it comes to telling people about your diabetes, I would say the main stigma that I've experienced, because I would say everyone's experience is very different, but from what I've observed and seen from Thai culture, a lot of the stigma comes from lack of knowledge. So type 2, I think, is the same in India. Type 2 is more common. So everyone associates, oh, you have type 1 diabetes, so it must be like type 2. So the initial one is, oh, did you eat a lot of sugar as a kid? Your parents must have made you eat so unhealthy. Oh, but you're not fat, so how'd you have diabetes? Or um does someone in your family have diabetes? Like, you get these questions so many times, and I would say I try to be positive because I'm all about spreading knowledge, right? So if you give them a bad reaction, then that's not going to be good. So with with me, I would say the stigma is all about not understanding type 1. So usually the stigma that I face would just be like, oh, should you be eating that? Or for example, when I'm at work and we get like a gift basket from a patient, and then my coworker's like, oh, here, have a chocolate bar. And they go, oh, wait, you can't have that because you have diabetes. Can you eat this? It has sugar. And it's like, well, yeah, obviously I can eat that. Or if I'm drinking like a sweet drink, or if I'm having a coffee, they go, are you sure you can eat that? Like, is that good for you? And it's like, to me, I always say everything is in moderation. I can eat, I can eat 50 cakes and it would be terrible for me. But if someone without type 1 eats 50 cakes, it's just as bad for them. Like, I don't see the difference in that, right? So it's all about moderation. And like I was telling you behind the scenes, so my first really negative experience with stigma here was when I lost my job offer, because I'm a nurse and I've always been interested in being in the ICU. Um, like with most type ones living with diabetes, it's all about fluctuations, right? There's not going to be a day where your blood sugar doesn't go above 200. If so, then hey, good to you, right? But the stigma here, and this is what surprised me the most, because this came from a hospital. And so I went in to do my health checkup to start work in like 2 days, and that day I have a lot of hypos at night, so around 2 3 a.m. I'm always having a hypo. So I made sure to decrease my bedtime injection because I knew that during the night I would be low. But because of that, it made my blood sugar in the morning about 170, 150. I don't remember the exact number, which to me is not high because anything over like 230, then I'm like, ah, maybe I'm a bit high. But it was about 150, 170, and it came up on the blood test. And this was for my job that I was going to start. And the head nurse who saw my papers, she was like, "Oh, we're gonna have to get the endocrinologist to come and have a look to see if you're fit to be a nurse because your blood sugar's high." And I thought, well, this is not my A1C. Like my A1C is 6.4. Like it's I would say it's good, and I worked hard to get there, right? So I told them that. I said, "Hey, this is the reason why it was a bit high because I tend to have hypos at night." So and they were like, "You have hypos?" As a type 1, that's so dangerous. You have hypos? Oh no. So then they said, "Oh, you have to come back. We'll have to see again if you can work with us." So they called me back the next day and they said, "Because you have type 1 diabetes, we think you're unfit to be an ICU nurse and we think you should be doing a much easier job." And I've never been told no in my life when it comes to diabetes. Not in a spoiled way, but no one's ever told me, "Oh, you can't play football because you have type 1," or "You can't go on a hike because you have diabetes." So that's why I went into nursing, because I thought it's just something that I have to manage. It's my day-to-day life. If I can't take care of myself, how am I going to take care of my patients? So it's always my main priority is myself, right? So having been told that I couldn't do something based on something that I have no control over, in the terms of, like, I can't control having diabetes or not, but I can control how I care about myself. So being told no, like, that was the first time I've experienced stigma. And truth be told, it's really common in Thailand for people to lose their jobs because they have type 1 diabetes, or people will not tell anyone that they have type 1 because of the stigma around, "Oh, it's a dangerous condition to live in," which in terms it is, but with the right care, the right support, and like the right mindset, like anything's possible, right? So I've never had that before. It was a big shock to me. But yeah, like I'd like to decrease that sort of stigma in Thailand, especially around work, because it took me so long to find a job, especially in healthcare. And that's why I was saying it was so shocking to me that hearing this from like a nurse, and she had a clinical diabetes educator license, and she was telling me I was unfit. So I thought that was super ironic. But yeah, so I'd like to change the mindset around type 1 in Thailand for sure. And I feel like it's kind of similar in India too, right? Sanskruti, with like the stigma.
That is just so annoying to hear. I don't even know if it's sad. It's just annoying to hear that when something like this happens in a healthcare environment. Um, yeah, I don't know. Okay, so Prashant has a question for you. Do you overeat in stress or in excitement? And if yes, how is that journey like?
I would say when I'm stressed out, it depends. It depends. I would say I'm not really an overeater when I'm stressed, because I find that a lot of my anxiety, it manifests in my stomach. So I always feel super nauseous when I'm anxious or stressed out. So I find that I can't really eat anything when I'm stressed out. But I do have friends who are type 1, and they're like, "Oh, every time exam season comes up, they have to tell their doctor, like, hey, the A1C is quite high at the moment because of exams." And if you normally have an understanding doctor, they're like, "Ah, okay, that's fine." So I can see it, how it can be an issue with a lot of people who have type 1 as well. But luckily or unluckily, I have nausea when I'm stressed out.
Yeah, really. With me, I don't tend to stress eat a lot, but then my sugars are automatically on the higher rates,
Yeah.
even if I'm not eating. So even if I don't eat dinner, I will end up with a higher blood sugar in the morning if it's like a exam season. I remember like few years ago when I was giving competitive exams, and it used to be like a month long competitive exam season where every other day I had exams and my sugars were like really really high, and I didn't know how to handle that because in the morning you have to go give exam and you don't know how to like focus on your exam or focus on bringing your sugar down, and what to do in that situation. It becomes nerve wracking.
I mean,
Yeah,
for me, it's the same with exam season. So I like a couple of months ago, I did my Thai nursing license. So in Thailand, when you do your nursing license, it's basically there's 8 subjects that you need to take, and then you have to pass all 8 subjects in order to become a registered nurse. And I wear a CGM, and it's connected to my phone. But during the exams, you're the only thing you can bring in is a pencil, an eraser, and your Thai ID card. And you have to put everything in like a Ziploc bag and put it on your table. You cannot bring anything else in. And these exams are done in one day. So you're in the exam hall from like 9 a.m. till 5 p.m. And you only have 40 minutes for lunch break. And I remember just this, like I tried to, so the day before my exam, I tried to plan out how I was going to do this because I was technically going in blind. It felt like I was driving a car. I just had my eyes closed, right? That's what it felt like. So I decreased my insulin because I did not want to go low during the exam hall. So I thought to myself, I much rather be a bit higher than I want to be. So I lowered it a little bit, but man, when I came out that exam hall, Sanskrit, my blood sugar was it literally when I opened my CGM app, it was just like this is the baseline, right? It was like up here for 8 hours. I was like, oh no. I felt so dehydrated. My eyes were so dry. My brain felt like someone had put cotton in my ears. I get what you mean. Exam season in and diabetes do not mix at all. It's the worst feeling.
wow, wow. Okay, so you aren't able to carry like emergency stuff with me when I was giving my 10th boards exam, which is like a big exam that you have to give. I was able to carry my glucometer because that time I was not on CGM. I had never seen a CGM, but I was able to carry my glucometer. I was able to carry some snacks with me in case, because that time my symptom was extreme hunger. If I'm going low, I would be extremely hungry. Like I've not eaten since like 10 days or something. So my mother used to pack me some snacks and like a juice box. So I don't go like really low. And I was able to keep that in a parallel, like adjacent desk, which was empty. So if I needed, I could take it from there. So yeah, that was the case with me. It's kind of surprising that for a type 1 diabetic, you were not able to carry like a emergency hypo kit, if you may.
It's a big so if going back to stigma, right? I think in a different scenario I could have explained myself, but with the Thai nurse, it's just there's so much nuance behind it because how they do the tests are still very traditional. So I had to sit through two exams. So I was missing like one more subject, so I had to wait for the next rotation like a couple of weeks later to take the second round. So the first round was okay because I was at like a private university taking my exams. And I told the nurses, because all of the nursing professors are the ones who are like monitoring the exam, right? So when I went in, I said, "Hey, I'm type 1. I wear a CGM, but I understand I can't bring my phone in. This is my glucomonitor. This is my sugar that I've prepared, like my juice boxes." And they were like, "Okay, I'm going to keep this with me. If there you have any emergency, if you don't feel right, you raise your hand and then we'll like escort you to make sure you can do that." But to me, the fact that I had to rely on someone else, on something that I've always relied on me for, is always such a nerve-wracking thing because you get so used to being so independent. So the idea that you have to ask someone else to support you was kind of weird for me, but luckily I had no issues. However, the second time I had to sit through my exams, I was at a military nursing university, and like I said, they ran it like the military. It was intense, right? So the idea of me telling the nurses that, hey, I have diabetes, I knew I was not in an environment where I would be accepted, and I felt like if I were to tell them that I had type 1, I would be met with, oh, but then you shouldn't be a nurse because you have a health complication. And nurses in Thailand have to be like the image of what health is. And because you have a condition, you're unhealthy. So I knew that I wasn't in a safe space to tell them that. So luckily, I only had 2 hours, not 8 hours. So I kind of pushed through and not tell anyone. But also, my blood sugars were like Mount Everest afterwards as well.
Okay, wow. Okay, we have few questions over here. Okay, so the first one is what CGMs are available in Thailand?
Okay, so to answer the question about CGMs, I am relatively new. I only knew what CGMs were until about 2, 3 years ago when I went to the like the IDF conference in Portugal, and I met people wearing CGMs, and I was like, where has this technology been my whole life? Because CGMs are very rare in Thailand, and they're all paid out of pocket. Insulin we get through the government. Blood strips, if you're in the right programs and you're affiliated with the right hospital, you also get for free. But CGM's pumps are all out of pocket. So at first, I was getting my CGMs through Singapore. So anytime I would have friends flying through Singapore, I would use the Freestyle Libre, but the Freestyle Libre, I think one, like the old one with the scanner, right? Um, and then I think the only available CGM in Thailand that you can get is Medtronic. But I personally, I find because of no competition, the prices are much higher than I can afford, because I'm paying out of pocket myself. So I find they're a bit more expensive for me. And I'm also allergic to their adhesives. So
The
I
glue,
don't really
yeah.
want, yeah, the glue. I'm really allergic to that. So after meeting with a bunch of people abroad, I've now been using a lot of Chinese CGMs because you can get them here for quite a relatively affordable price. So at the moment, I'm using a brand. I mean, I don't know if I should like plug any brands. Hey, I'm not sponsored, but if anyone who's associated with Otai CGMs want to sponsor me, I'm so free for that. So I use Otai CGMs and I get them from China. So I would say they're not, is it F? No, it's not FDA. The ones in the States where they approve the products. Yeah, so they're not approved by the US, but I would say personally, price and durability and accessibility and how easy of use they are, I really like them because they're connected to my phone and they are 15 days because because usually we're used to 14, right? But it's you have like a 1 day grace period, which I really like. And the adhesive is quite breathable. So I find that I don't get like rashes when I wear the adhesive. So it's been working really well for me, if that answers the question.
Yeah, 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 it does. So yeah, it was quite surprising to know that CGMs are not very common in Thailand, because in India right now I'm seeing that a lot of people know about CGMs, even the people who are not diabetic, because a lot of fitness enthusiasts tend to wear them and track their blood sugar levels, or I don't know, yeah, blood sugar levels only, and tell everyone how their body is reacting to different things, and different routines, whatever they're doing throughout the day, or whatever food they eat, how their body is reacting to that. Or when a person who is a gym enthusiast wears the CGM and tells, okay, this exercise affected this much, or this was my graph after this exercise. Yeah, so it has become quite common in India for people to know about CGMs. And yeah, there are quite few available here in India. We have like a Libre, yeah, we have Libre One, Libre Two, Lynx, Tracky, ICANN, and Medtronic. So
Mm-mm.
yeah, there are few companies with a lot of competition, but yeah, there are still companies where people can, they are on the highest side, and here in India we have to pay for them out of pocket, and nothing is from the government. But yeah, people are more likely to get the CGMs because it is connected to your phone, very accessible. If you're on a run, you can just track it, look it on the screen, and yeah, they're very, very, very accessible, I would say. Yeah. We have another question. What is the general cost of rapid acting insulin in Thailand? So, as we know that Marlena has already spoken about it, and if you're affiliated in a correct program, you get all your insulins from the government, and you don't need to pay for it out of pocket. But yeah, what does your prescription say? Like, do you get both basal and rapid acting insulin, or in case if you need a different rapid acting insulin, can you get it over the counter, or you need to have to go through the doctor and through the process for getting it?
I would say the process is quite simple. A lot of pharmacies will have insulin, but it would have to be like bigger affiliated pharmacies, like pharmacies that sell in bulk, not like your usual cough medicine pharmacies. So we do have a lot of places that stock insulin, or you can pre-order through them. I had a situation where I didn't pack enough insulin when I was traveling around Thailand, so I had to buy from the pharmacy. If you are in like a pharmacy that is in bulk, then they don't really charge that much for tax. So I would say this is from the prices that last time I inquired. My regimen is Novel Rapid Pen and Lantus. These are my two insulins that I use. Other insulins like Tresibre, Toujeo are also available in the in the public healthcare, but it depends of the hospital. So my hospital only stocks Lantus and Novel Rapid. I can buy that out of pocket. So I would say one box of Lantus pens. I think it's about four, right? Four pens, 4 to 5 pens is about 1,800 baht. I'm so sorry, I do not know the Indian to Thai conversion rate. But if anyone wants to Google that right now, go ahead, please help me out. It's about 1,800 baht for a box of five, and I think a box of Novo would be about 800 baht, which I would say is relatively affordable in Thailand. I think Tujio and Tresiba, I think one pen is about 8 to 900 baht. But this was I inquired about this like 4 or 5 years ago, so I'm pretty sure since then it's much pricier. Like the price has definitely gone up since COVID for sure. But this is the last time I inquired. Luckily, no prices have gone up since then.
I hope no prices have gone up. So yeah, we have done the conversion. So 1800 baht is around 5200 rupees, for which you get around 5 cartridges. Is that right? Yeah, yeah. So relatively, yeah, in India, I think we can get it in under 600. Like I remember getting Mixtard and Act Rapid for around 300 a cartridge. So in 1200 rupees, I can get three cartridges. Pradesh has a question for you, Marlena. What food preferences and precautions you have about food, and what does your daily food plate looks like?
Okay, so for me, I I'm gonna go. I'm gonna say ahead. I love sweet drinks, and in Thailand, I don't know if anyone has tried like Thai tea before. I love Thai tea, but it's super unhealthy for you. I also love me a cappuccino and a coffee in the morning. So I would say if you were to take like nutrition advice from me, probably not the best person because I love my sweet drinks. However, I've been cutting down on my portion sizes because during my exam seasons, I gained so much weight. So right now, I cut my portions in half and I like to prioritize proteins, less carbs, more proteins, and of course, more fiber. And a lot of my when I make coffees myself, I would like to replace the sugar with more like stevia, like natural sugars, where I don't have to inject as much. I just inject for the milk that I put in. So there are, and I because I'm a nurse, I find that when I'm not snacking, then I know it's a busy shift. So I think because I was diagnosed so young, I don't really have snacking culture. I don't really feel like I need to snack because then there's just more effort for me. So I like to have my meals at the same time. So usually when I eat, I have my main meal and maybe a sweet drink and like a little dessert. Usually fruit is a better substitute for that. That's usually how my meals would look.
Yeah, I think protein goes. along the way. And yeah, I know that Nupur has cut all her carbs down and only eats protein, and it becomes so much more easier to handle your dosing accordingly, and you know exactly how much amount of insulin you would need for it. And yeah, so Johan says that 800 baht for Novo Rapid, and how many units are there in that cartridge?
Oh, I think I don't have my insulin on me. I think it's 100 units, if I'm correct. Yeah, I could be wrong, guys, but I'm pretty sure it's 100 units last time I checked. It's like the Penfill cartridges? Yeah, 100
Yeah, I
units.
think the same cartridge that we get, the 3 ml cartridge with,
Yeah, and they're like
but
orange, right?
yeah. Okay, we have few minutes left before we close down this conversation. I would like to ask the audience if anyone has any other questions for Marlena, or if anyone wants to know anything else, what happens in Thailand, how she's been living her life in Thailand, or anything else that you want to ask her. This is the time, and soon we will be closing this conversation here. Uh, Anything else anyone would like to ask? During that time, I would like to ask you, Marlena, in this time that you have been a diabetic, were you always like sure about becoming a nurse, or because you were diabetic, that's how you found, okay, I want to become a nurse?
I That's a good question. A lot of people have asked me this actually. I do think I've always wanted to be a doctor actually when I was like as far as I can remember. But I think after being diagnosed with type 1 and growing up with it, I find that I gravitated more towards the nurturing side, and I thought maybe a doctor would be too technical for my passion. And I found that nursing was more like connection to me. Everyone has a different experience, but I really wanted to be part of, helping the patient heal day by day. And I think being type 1 really motivated me to go more into nursing, but it's also definitely made me want to go into endocrinology because I do plan on working with type 1s when I get more work experience because I'm in the process of doing my clinical diabetes educator license, but I need more experience before I can apply. So I definitely see myself working with type 1s and being an educator later on in my career. So I would definitely say diabetes is the main factor.
Good luck for that. I hope everything goes according to your plan. And so we have another question. A lot of Thai food, it has a lot of sugar, but it is delicious. So how do you navigate this? And do you have any tips on eating out, or how do you navigate your insulin requirements when you're eating out in Thailand?
This one's a really good question because I have a lot of friends who come abroad and ask me how do I calculate or carb count for my food because they're also type 1 and they might be from the UK or different countries, right? And I find that everyone's bodies reacts to different cuisines very differently. To me, like the comment said, the question said that Thai food's very sweet. So I'm really used to every meal that I calculate, always a couple of more units, like 1 to 2 more units above. Like I never go down, I always go up. Just because you don't know what kind of like coconut juices or maybe MSG or sugar that's in the food, right? So pretending I see like a bowl of rice, okay, I know that my rice is going to be 18 carbs, that's 2 3 units for me, and there's some fruit, and I have a curry. And I know that in the curry, there's definitely coconut milk, and that's going to mess up my blood sugar. So, on top of that, like I would add a couple of more units. It's all of, to me, I feel like I've just been eyeballing my carb counting because I'm used to the cuisines. But yeah, definitely Thai cuisine. Um, it is healthy, I would say. It's very like vegetable and high fiber, but of course you don't know what the secret sugars are behind, so always like to inject a bit more. And I would say spicy foods also can affect a lot of people's blood sugar as well. Spicier, like more oily foods can cause blood sugars to be a bit more stubborn as well. So be aware of that if you're coming to Thailand or eating Thai food.
Yeah, true. Spicy food do increase your blood sugar. We have another question for someone who's visiting Thailand every few weeks, but not a Thailand citizen. The resources are is the resources easily available, like insulin, syringe, strips, etc., or any other things for who someone is traveling to Thailand? and need it over the counter?
Yes, I would say if you're in Bangkok, definitely accessible. If you were to go to other places like Chiang Mai or Phuket, I would say my Phuket maybe okay, Chiang Mai, if you're in the city, the more rural you go, the harder it will be to get the insulin or the supplies. But if you're in Bangkok, definitely can get the insulins. I would recommend going to areas near bigger hospitals because they have a lot of clinics there that will stock more insulin. So if you are in Bangkok and you need supplies, definitely go to big hospitals that have clinics nearby or pharmacies nearby because they will stock. But most pharmacies and Watsons and Boots will have blood strips, but not insulin. Yeah,
Yeah, but it's always good to carry everything in access. I would say
exactly.
whenever you're traveling anywhere, not just in Thailand, but in India or any other country, you should always carry more than you would need because you never know what would happen to your in-use cartridge, or something might break, or something might get lost, or anything can happen. So you should always carry everything in access, or everything like double, so that you don't need to, you are like stranded somewhere and you don't have any accessibility, but you always have your extra storage
I
things.
guess it goes the same with when you go on holiday, you always pack more underwear. It's the same with your insulin and your diabetic supplies. Always pack more because you never know when you're gonna need an extra pair or an extra insulin. So always pack more insulin, guys.
Yeah. That is so true. Last few questions I would like to see if anyone has any other question. We would soon be closing this conversation here. um, yeah. Okay, so last question I have for you is, what has been that one good thing about diabetes that you realize now than before when you were diagnosed?
I, for me, would say I realized I could turn something that was, I don't want to say negative, but I definitely turned it into something positive because I'd say being diagnosed with a chronic illness is a terrible thing and I wouldn't wish it on anybody. But being able for me personally, being able to turn such a, I would say, bad thing that happened to me into motivation, my career, my life goals, what I want to do. I find that having diabetes has made me more responsible, maybe too responsible. Um, but yeah, I think trying just turning a bad thing into a good thing. And I've met so many amazing people. I've met so many communities and I've made lifelong connections, and I have people who understand me. And I don't think that if I didn't have diabetes, I would be able to experience such things. So there are always positives in the negatives. And I think being able to overcome them has been like a big thing for me. And I think my personality is really shaped around how I live my life with diabetes. So I would say I am quite grateful for what I've been able to turn it into.
That is so true. I always like to say that everything happens for a reason. And if I got diabetes, there was a reason, because when I was young, I was a very, very picky eater. My mother could never make me eat any vegetable. But now that I know and I look back on my time, I realized that if I didn't have diabetes, I don't know, I might not be eating any vegetables till now. But now that I know how important it is for you to have correct amount of food and fiber and all kinds of leafy green vegetables, uh, I see that it's a good thing that I had diabetes, so that my food includes everything else and not just protein. But yeah, protein is important. But yeah, like my plate now has everything. But if I didn't have diabetes, I am so sure that I would be such an unhealthy eater. So I would like to see the positives of having diabetes and not the negatives. We all know what we go through every day, and we make 10x more decisions than anyone else here who's not living with diabetes or any chronic illnesses. Um, yeah, but I'd like to see the positive outcomes of a chronic illness here. With that, I would like to say thank you for joining this conversation here. I had so much fun talking with you and understanding how Thailand has different programs where you can get affiliated to and get your insulin. And That was really nice to hear. If anyone does not have any questions, we would be closing this conversation. Thank you so much for joining us. And we are available on all the platforms that you can think of: YouTube, Instagram, Facebook. And we have a community of more than 14K people here. And we talk about diabetes, how you handle your day to day life, your routine, your sleep cycles, anything and everything. And we have been conducting these workshops or these talks from different people around the world and India. And please, if you would like to hear more, you can check our community page on Facebook. We have lots of conversations there. And for more conversation, follow us. Stay tuned for the next one. I am sure it's going to be as insightful as this one was. And with that, Marlena, thank you so much for joining and see you soon.
Thank you for having
Bye.
me. Bye.